Welcome to Decode Healthcare with Harshal. We are kicking off something absolutely massive today. This is the start of our 20-part Musculoskeletal Explainer Masterclass. We're jumping right in, zeroing in on the foundational general CPT codes. Now, these are the codes that aren't restricted to just one single body part. So if you've ever felt completely overwhelmed by orthopedic coding, well, you are in the exact right place. Here's our game plan for today. We'll start with trauma and wound exploration, then move into general excision and biopsies, dive right into introduction and removal procedures, and then wrap up part 1. Let's get to it. Section 1. Trauma and wound exploration, which covers codes 20100 through 20103. Okay, before we even look at the specific coding rules, we really need to understand what the surgeon is actually doing in the room. So, picture a deep, penetrating trauma. We're talking a gunshot wound or a severe stab wound. The surgeon has to get in there and thoroughly explore the damage, right? They're literally tracking the path of that bullet or knife to see exactly which tissues, muscles, or blood vessels were compromised. Basically, in plain English, they're opening the wound up to look inside and clean up the mess. Now, listen closely because here is the absolute most critical rule you have to memorize for these codes. CPT specifically states that these exploration codes already include a whole list of steps. They bundle in the surgical enlargement of the wound, extending the dissection to see deeper, debridement, which is just cutting away the dead tissue, removing foreign bodies like bullet fragments, and tying off minor blood vessels. Because all of these steps are considered completely inherent to the exploration itself, you should literally never code them separately when using 2100 to 2103. Never. So, since all those surgical steps are bundled together into one package, your only job as a coder is to pick the right code based purely on the anatomical location of the trauma. It's actually incredibly straightforward. 20100 is for the neck. 20101 is the chest. 20102 covers the abdomen, flank, or back. And 20103 is for an extremity, like an arm or a leg. You just follow the anatomy. Keep in mind, though, the guidelines do state that if a major structure or blood vessel requires a full laparotomy or thoracotomy to repair, you'd use those specific codes instead. Section 2. General excision and biopsies, covering codes 2150 through 2251. So, what exactly is a biopsy in this context? Simply put, it's when a surgeon extracts a small core sample of muscle or bone to send off to a pathology lab for testing, usually to check for things like cancer or muscle diseases. But here's the trick. To code this accurately, it's not just about what tissue they sampled. You absolutely must know how deep the surgeon went. This breaks down the core difference perfectly for muscle biopsies. Code 20200 is for a superficial muscle biopsy. This just means the surgeon is taking a sample from a muscle that lies right near the surface of the skin. Super simple. But on the other hand, code 20205 is for a deep muscle biopsy. This requires the surgeon to dig much deeper, physically cutting through layers of fascia to access a muscle sitting deep down within the tissue bed. And you know what? The exact same logic applies to bone biopsies. When a surgeon uses a trocar, which, by the way, is basically just a thick, hollow needle to extract a core sample, the CPT guidelines split the codes based entirely on the depth of the bone. So code 20220 is for superficial bones. Think of the bones you can easily feel right under your skin, like the sternum in your chest, the spinous processes of your spine, or your ribs. But if the surgeon has to drive that trocar deep into the body, say into a vertebral body or way down into the femur in your thigh, you have to upgrade to the deep bone biopsy code, which is 20225. Section 3. Introduction and removal, covering codes 20500 through 20705. Let's look at a common procedure here. This cross-section shows a surgeon inserting a needle directly into a muscle trigger point, specifically the multifidus and longissimus muscles in the back, to inject a therapeutic medicine. Trigger point injections are incredibly common for pain management. The codes for this, 20552 and 20553, depend purely on the number of muscles injected, not the number of actual needle pokes. But honestly, perhaps the most frequently coded procedure in this entire section is arthrocentesis. Now, if that sounds intimidating, don't worry at all. Arthrocentesis is really just a fancy medical word for sticking a needle into a joint capsule to either aspirate, which means draining out excess inflamed fluid, or to inject a medication, like a corticosteroid for pain relief. And sometimes the provider actually does both at the exact same time. This perfectly anchors what we're talking about. You can see the exact moment the needle penetrates the articular capsule of a major joint, which in this case is the hip. You can easily visualize the provider either pulling back on that syringe to remove fluid or pushing the plunger to deliver the therapeutic agent directly into the joint space. So, to code arthrocentesis accurately without just guessing, you must use a matrix like this. You categorize the procedure across two major axes: the size of the joint and whether or not permanent ultrasound guidance was used. For a small joint like a finger or toe without ultrasound, it's 20600. If they used ultrasound guidance, it becomes 20604. For an intermediate joint like a wrist or ankle without ultrasound, it's 20605. And for major joints, like the shoulder, hip, or that inflamed knee, it's 20610 without ultrasound and 20611 with ultrasound. You simply cross-reference the joint size with the imaging technique, and boom, you have your perfect code every single time. Section 4. Wrapping up Part 1 of our foundational codes. The absolutely crucial takeaway today is that mastering these general foundational codes is the key to unlocking the rest of the musculoskeletal system. Huge congratulations on conquering Part 1 of this masterclass. Make sure you subscribe because next time we are tackling Part 2, replantations, grafts, and implants. It's going to be great. I'll leave you with this one thought. Are you ready to decode the rest of the 20,000 series with zero fluff and fierce accuracy? Take a few minutes to review the matrices we discussed today, and I will see you in the next explainer.